This is your health show. Thank you so much for joining us. My name is Purity Museo, and welcome to this very, very interesting episode. Now, if you're newly pregnant or trying to conceive, you have many questions about what to expect. How will your body change? What's happening inside you in the next 4 weeks? We will help you through your 9 months of pregnancy so that you can be a smarter, more confident, more prepared mom-to-be or even a caregiver. Each week, we will offer information about a mom's body, the babies, as well as helpful advice one can use throughout their pregnancy. Dr. Maureen Owiti, a gynecologist, will help us with this discussion in the next 4 weeks. It's going to be the most interesting, informative, educative. Will only require you to sit back, relax, and enjoy the show. Remember, you can always be part of the conversation by either sending in your questions, comments, and contributions to @KBC Channel 1 @Purity_Museo on Twitter, Facebook, and all other social media platforms. So today, we start with the first trimester of pregnancy. Welcome to the show once again. Dr. Maureen, it's good to have you, and I'm very, very excited to talk about pregnancy from the first trimester to the very last delivery, and we are looking forward to learning so much from you.
Even me, I want to watch the show.
And when you talk about pregnancy, am I even allowed to ask the expert what pregnancy is? Are we aware of what pregnancy is? Is there a definition that most of us don't know, but we only assume we know what pregnancy really is?
Pregnancy is, interestingly, would be when there is fertilization has taken place and there's an embryo. A normal pregnancy, we expect it to be inside the uterus, inside the womb of the mother. We have what we call abnormal pregnancies. So these can either be a pregnancy that is outside the womb of the mother, what we call an ectopic gestation, or pregnancies that will end up as a miscarriage. A miscarriage can occur in the first, second, or even third trimester, but for first trimester miscarriages, that could be one of the outcomes of the pregnancy. But for a normal pregnancy, it will be a fetus or multiple fetus that are located inside the womb of the mother.
And when you talk about a normal pregnancy, what do you mean by this?
We know that the human pregnancy takes 40 weeks, and it's one of the jokes I always have with my clients. They always make me, but Dr. that means I'm pregnant for 10 months. And I'm like, okay, yes, 40 weeks would translate to 10 months, but that is if you're talking about 10 lunar months, which are 28 days. We all know in the normal calendar, except for February, all months are more than 28 days. They're on average 30 or 31 days. So you can see after every 3 months, we'd have an extra week that is unaccounted for. So if you look at it, the gestation is 40 weeks, which would be slightly over 9 months. So it's 9 calendar months of the pregnancy. So the human gestation will normally take the 40 weeks, and that's the duration of the pregnancy. But normal, we'll talk in terms of the location and in terms of the outcome of the pregnancy.
Yeah. Is it okay, advisable to prepare for pregnancy?
I think that's one of the places that we're really, really failing women, because definitely it is advisable to prepare for pregnancy. We advise that women should actually start what we call preconception counseling. At least they should do that 3 months before they plan to be pregnant. In the preconception counseling, we are normally going to just check, does she have any risk factors that can be taken off? So simple things like diabetes, does she have any medical condition like asthma, does she have a cardiac disease? So to look out for some of those things, there are those which are able to treat, like diabetes is treatable, and we are able to, I'll not say treatable, but manageable, because you can't cure diabetes, but you can manage the condition. So if somebody has diabetes and they are under control before the pregnancy, you'll find that that pregnancy is actually going to progress like a normal pregnancy for somebody who does not have diabetes. So we're going to screen for anything that would have an impact on either the pregnancy itself, the mother, or the fetus. And for most people, they're normal. The dictum in medicine is normal things occur more normally, so we're expecting a normal pregnancy. But there's a very high incidence of what we call neural tube defects. Those are abnormalities of the nervous system of a baby. And this is something that has been proven to be quite preventable. More than 95% of cases of the neural tube defects is because of deficiency of folic acid. So it would be to just give them that opportunity to start supplementing folic acid, because it's something that we could actually prevent. Yes, not everybody is going to get these abnormalities. Just so that the audience can understand what I'm talking about, we have these babies who are born with a lot of water inside their brain. So their brains, their head is really big. We call that a hydrocephalus. Or there's some who have a hole in the spine, and it can occur any other area along the spine, and we call that a spina bifida. These are conditions we're saying 95% of the time we can actually prevent. And it's by taking the folic acid supplementation, and that is why we advise all mothers, regardless of where they come from, that they should be on folic acid supplementation prior to the onset of pregnancy. So basically that's what we're going to do. So yes, ladies, please, planning to have a baby, go for a preconception visit.
Let's talk about maybe how you can prepare your body for, pregnancy. I'm talking about lifestyle. Are there some foods that you're supposed to increase there? I don't know whether it's a misconception, but people talk about, if I want to conceive a boy, I want to conceive a girl, or even twins, then this is the kind of food I want to eat. Is that true? And then probably you can also advise on the exercise, like what's the overall lifestyle? What should it be like?
Okay. It's just because, unfortunately, in medicine, we're taught to be very honest people. I'd be very rich if I would be making money from telling women, I think, have intercourse on your ovulation day and you're going to get a boy or something like that. What you must understand is that for a pregnancy to occur, an egg must be released and sperm must meet with that egg so that fertilization can occur. For a normal pregnancy, a normal couple, when they have intercourse, the man will actually release millions. A normal semen count has about 40 million sperm. Of that 40 million sperm, 50% are going to have the X chromosome, which is responsible for getting a female child, and 50% is going to have the Y chromosome. The egg is always X, so we always contribute one X. So if it's an XX, we're going to have a girl. If it's an XY, we're going to have a boy. Now, these sperm, there are 40 million, mixed 50% here. How do you choose that? Oh, where? And you're going to fertilize this particular child. So scientifically, it's not feasible. The only scientific way of ensuring gender would be to do an IVF cycle and do a genetic screen and only transfer the gender of interest. So other than that, yes, there are people who are successful. They are told, do XYZ and you'll get a girl. They do and they get a girl. There are those who are told, do XYZ, they get a boy. No, and they get a boy. But what you must remember, what are the odds? We've said it's 50%. So if it's not a girl, it can only be a boy. There's no other alternative. So of course, 50% of the time, this person is going to be correct. Now, if you have somebody who is peddling some interesting theories, 50% of his clients are going to be happy because they're going to have achieved what they have. And the other 50%, they always find some interesting way of telling them, oh, you didn't do this. Did you do this? You didn't do this. And that's why you didn't get the gender of interest.
So do you mind sharing a few tips on how a woman can prepare for pregnancy?
Yes. So again, we've talked about lifestyle diseases. So we've mentioned diabetes, and the other is obesity. I don't like talking about obesity because I'm a bit overweight myself. However, I'm not preparing for a pregnancy. I can talk with my physician because I have hypertension, so I'm trying to work on my weight actually. But back to the women. Yes, you find something like obesity, one, would reduce your chances of pregnancy in the first place. okay? And it's going to have an impact on the pregnancy itself. So you're going to have increased risk of getting things like high blood pressure of pregnancy, diabetes of pregnancy, and all of those things. So obviously we want to have the woman optimum prior to the actual onset of the pregnancy. So if you are on a BMI scale considered to be overweight or obese, we're obviously going to advise you to try to lose some weight before you get pregnant.
Yeah.
So it's just the normal, it's a lifestyle change. Can we have a healthy diet? A healthy diet means you eat a lot of vegetables. So your plate ideally should either be, there's the 1/3 rule or half and 25-25. So if you do the half 25-25, your plate should be vegetables. 50% of your plate is vegetables, so half your plate should be vegetables, then a quarter of your starch, and a quarter of your protein, a quarter of your protein source. If you're doing a third, it's just a third of each of those food groups. We also advise intake of fruits, a lot of fruits, and hydration, very, very important. 2.5 to 3 liters of fluid on a daily basis.
Yeah.
Exercise, we don't have to be elaborate. You want to gym, please. You enjoy doing your yoga, whatever. Swimming, I personally love swimming. Whatever physical activity you enjoy, please, by all means. The golfers can golf. Those who play Suji Kati and I don't know what, do it. Be physically active. But it doesn't have to be elaborate. You don't have to go to the gym. Something as simple as a brisk 30-minute walk on a daily basis is good enough and actually very healthy. And when we say brisk, what we mean, I'm walking with you, Purity, we're having a walk and we're trying to have a conversation. I should be able to talk to you, but I'll be strained, like I'm panting when I'm talking. That's a brisk walk. It should not be those leisurely to Kokwa Beach and we're just strolling and enjoying the atmosphere type of thing. So, So,
and as we stay with the preparations, do contraceptives affect the fertility of a woman? Because there's so many questions regarding this.
Excellent question.
Yeah.
Now, contraception, we tell you that even in the most effective methods, you have about 1 to 0.5% failure using the method. In the not so effective methods, will be about, say, 30% failure rate. Now, if you're saying on the method, you're conceiving, how is it all of a sudden you're off the method, you're not going to conceive?
Yeah.
What we're saying is if you are on a method and you have stopped using the method, okay, your fertility resumes immediately, okay? Now, there are probabilities, maybe somebody has a hormonal problem, maybe somebody got a tube problem, maybe the husband has a problem. Are you smoking? Are you taking drugs? Are you using alcohol? We have to look at what other things could be causing this woman not to conceive, okay? But to say that contraceptives cause somebody not to conceive, they won't when you're using them, but not while you're off them.
Okay, much of the preparations to get pregnant, let's talk about pregnancy. How do you know that you're pregnant?
Okay.
Is it possible to know the very first day that you got pregnant or fertilization took place, or just advice, or just educate us? Is there a way to monitor and know, I think I'm pregnant even before testing, from the signs? From the signs. Yeah.
Unfortunately, our hormone levels are usually not significant enough to cause symptoms for somebody to be aware that they are pregnant. However, there are some few women who actually, you just feel you're pregnant and you know you're pregnant even before your missed periods. I've had somebody like, it's their day for the period and they come and they're like, hey doc, I'm pregnant, and we do the pregnancy test and yes, it is positive. For the vast majority of us, we normally are going to wait for our missed period. A missed period again is very subjective because it has to be somebody who has a regular cycle. Somebody with irregular cycles, that information may not be that accurate. But if you have a regular cycle, your period is a bit late, you're sexually active, obviously, or you have had some treatment to help you get to conceive.
Yeah.
You miss your period a week or so, the tests are quite sensitive. You can urinate on a urine pregnancy test, can tell you. Personally, I hate the urine pregnancy test, a lot of false negatives and false positives. I would prefer to do a blood test and confirm that there's actually a pregnancy.
Yeah. The first trimester of pregnancy, there are stages, 3 of them of pregnancy, first, second, third. when we talk about the first trimester, what exactly, how many weeks are we talking about? And you'll also be guiding us to understand what are some of the changes that women should expect in their bodies.
Okay, so like I said, the gestation is about 40 weeks. Our first trimester will be the first 14 weeks of the pregnancy. Our second trimester will be from the 15th week to the 28th of pregnancy. And our third trimester will be beyond 28 weeks of pregnancy. So when we're talking about the first trimester, we're limiting ourselves to the first 14 weeks of pregnancy.
Yeah.
So the first, what we call presumptive sign of pregnancy is obviously a missed period. You miss your period, most people will notice like 1 or 2 weeks later, hey, my period hasn't come. Then there are these other signs and symptoms. Unfortunately, they mimic your PMS symptoms, but your PMS would come, your period would come if you're not pregnant.
Yeah.
Your periods are late, and all of a sudden you're experiencing some breast tenderness. That's actually normally the first sign people feel. Then as the hormone levels rise, so what is happening is we have the fetus or the placenta is going to release what we call beta-HCG. And this hormone is going to continue rising during the first trimester. It's going to peak between 9 and 12 weeks of pregnancy, and then it's going to start settling and going down. So as the hormone levels rise, so even for my patients who've had a miscarriage, I'm like, if you're feeling nauseous, you're feeling you want to throw up all the time, you're actually throwing up, you're having breast tenderness, you're having bloating, all of those things, very irritating symptoms. I tell them, for me, I'm smiling, and they look at me, Doc, you're a sadist. I'm like, no, I'm not a sadist. Those signs are good because what they're telling me is that your hormone levels are rising in an adequate manner. And somebody who has good hormone levels, we can presume that most probably the pregnancy is continuing as it should be. However, Msema for me would always be the ultrasound. On the ultrasound, what we're looking for is one, the location of this pregnancy to ensure that it's not an ectopic, the number of gestations that we have. Is it a singleton pregnancy? Is it a twin gestation? Are they triplets, quads, whatever? And is it growing adequately? Now, the signs that we normally look for on the ultrasound to see if the pregnancy is normal is that we should have a sac. We should be able to see what we call a fetal pole. So early pregnancy, you just see something like a comma or a dot, what we call a fetal pole. And hopefully, we're going to see the heart shadow. It will appear like a black dot in the middle of this fetal pole, and pulsations of that heart. Of the heart. So that's the heart beating. So until the heart is formed, we're not able to tell you whether the pregnancy is going well or not. We're just able to tell you that yes, there's a sac, you're most probably pregnant. Can we wait for some time to be able to see if the pregnancy is progressing well?
So what are some of the changes that a woman should expect? Because you've talked about the baby here. It's, so for the woman, what are some of the changes should they expect during the first trimester of pregnancy?
Okay. There are some people who are very lucky, actually have absolutely no symptoms other than a missed period. And again, even the missed period is a misnomer. There are some few, thankfully, very few women who may still, the first few months, actually still experience their period despite being pregnant. So if the pregnancy is going as normal, we should not be getting our periods, we should not be bleeding. But for those who experience symptoms, it's what I mentioned. So that's the breast tenderness, nausea, they may be vomiting excessively, sensitivity to smells. There are those who they feel like spitting. You've seen people who have those paper bags, they walk with paper bags and handkerchiefs. And it's a very dismaying thing to have to spit all the time. Those type of things would indicate that most probably that's pregnancy, and hopefully a good pregnancy. The beauty is, for more than 95% of women, those symptoms are going to go away once they hit the second trimester.
Yeah, because during the first trimester, the symptoms are a lot.
Yes,
So
yes.
do we have red flag symptoms during the first trimester, and how are you able to tell? Because women are told to expect a lot of these symptoms during the first trimester.
Okay, definitely. Like if you're having, say you're throwing up maybe once just in the morning, that could be normal. But by the time you have somebody, they're throwing up excessively, like everything they see, smell, they're throwing up. Now that would not be normal, and it's actually not even safe for the mother. I would advise such a patient to go see their healthcare provider.
Okay.
Again, why we'd like them to come early would be, again, to query the gestation, where is the location of the pregnancy, because the pregnancy can appear to be going normal. So any bleeding would be abnormal. That's a potential for miscarriage. Any abdominal pain might be a bit late, but could also the possibility of either still a miscarriage or an ectopic gestation. We all know an ectopic gestation, so that is a pregnancy that's not in the uterine cavity. The most common place where it goes outside of the uterine cavity is the fallopian tubes, but an ectopic can be anywhere. It can be on the ovary, it can be in the abdominal cavity, it can even be on the cervix. So those are all the things that we're trying to screen for when the woman first comes in for their first visit.
All right, time is not on our side, but we end with the do's and don'ts. Maybe you can advise women right there. What are some of the things that they should be doing, avoiding during the first trimester?
Okay, so for me, I'll maintain prevention, always better than cure. So any form of preconception counseling, kindly do come for preconception counseling. You're not able to, as soon as you discover you're pregnant, please welcome. Gynaes are normally fun people. We're interesting people to be around. Don't be scared. Come and see us, have a visit, and enjoy your pregnancy.
Okay, thank you so much for this conversation, the first trimester of pregnancy. My name is Purity Musea. Thank you for being part of our conversation. Remember, next week we talk about the second trimester of a pregnancy, and of course, this is the 4th, 5th, and the 6th month of pregnancy. So you want to be part of the conversation, tweet us and also share your thoughts and feedback, comments, and questions on our social media platforms, KBC Channel 1. Do enjoy the rest of our programming, and God bless.